Now, one of the comorbid disorders that is highly likely to occur in ADHD, indeed it's the second most common comorbidity, as I've said, are the learning disabilities. The specific learning disabilities are delays in reading, math, spelling, handwriting, and language more generally. Those are typically the big five that we need to see whether or not they are present. Now, you'll get some indication of this from the history. Parents may or may not have mentioned that their child has had difficulties in these areas. But if not, then please go back and explicitly interview the parents about their child's history in these five areas and whether or not there is any indication that there might be some delays. In addition, I think it's very important for every ADHD child, because of the probability here that an LD is present, that you do a quick screen for the most common learning disabilities. And I mean just a quick screen. You don't need to be dragging out a 2-hour achievement test battery right at the get-go here. Instead, you could use a simple screener like the Wide Range Achievement Test 3, like the Wyatt, the Wechsler Intelligence Tests. You could pull a couple of subtests off the Woodcock-Johnson. You could use a few tests from the Peabody Achievement Tests, whatever your favorite one is, but you can do this in 20 to 30 minutes and be screening for reading, math, and spelling specifically, and of course, language more generally if you happen to be using a verbal IQ test or other measures of verbal development.